a series entitled Staying Physically Active While Stuck at Home. Our presenters for tonight are Liyen Patrick, a senior physiotherapist who is experienced in managing lymphedema patients with post-breast cancer surgery, as well as general cancer patients and survivors. And Sim, who is involved very much in geriatric rehabilitation in physiotherapy practice, especially in the area of elderly fitness and preventive care. She also specializes in Parkinson's management. They are both with Rehab Concept in Kuching. So I will now hand over to Liyen and Esther to take us through the session. Over to you, Liyen and Esther.
Okay, thank you very much. Good evening for all of you. Thank you for joining our session today. So this is our topic. All right, so for today, we are going to go through a few sections of it for the talk. So the first one is the importance of the exercise for cancer patients and cancer survivors. We narrow this topic down especially for us tonight. So other things is benefit of the exercise for cancer patients and cancer survival. And we're going to learn about the types of exercises that work best for you. And these two part, the last part of it is the immunity, which we related to the COVID-19 crisis and issue that we have, which is a good things to learn when we are during this MCO period. Okay, so other things is the basic guideline to do exercise safely for you to do at home. All right. So the first later, the last part will go into the exercise demo. All right. So for everyone here, and we need to know, right, why you need to be physically active during MCO. Okay, so we question ourselves. Physically move around is very important. So why and what are the reasons? So this is in general, nowadays, like everyone have this issue. So sitting and lying is the new smoking for everyone. So especially for the, for the new generation nowadays. So this is what we call addiction. Okay. So addictive to sitting and lying, the more we sit and lie down, the more we become lazier. Correct. So being inactive and not exercising is actually detrimental to health, especially in the aging population when we are reaching 40 years old and above. Okay. Right. So there is some reason behind it. So why the exercise is very important is there is an acute, long-term, and also late effects of cancer. They are divided into three aspects, which is disturbed in our physical aspect, psychophysical aspect, and also psychological aspect. So from the physical aspect, there is few things that involve, which is the bone loss and disease, muscle and fat mass imbalance, peripheral neuropathy, and also lymphedema. Okay, so I think everyone quite familiar with all these terms like lymphedema, all this. Psychophysical aspect is involved the pain. Patient will feel fatigue, or you become weak or tired, and also the sleep disorders. Many people can't sleep well during the treatment of cancer treatment or after the cancer treatment. All right. And psychological aspect, it involves the depression and anxiety, and also disturb your quality of life, and also reduce your self-esteem. Okay, so the next one. So why exercise is important? So exercise is a safe, non-pharmacological, and cost-effective therapy. So non-pharmacological, there is no drugs and medicine that involved in during exercise. So this can provide several health benefits in cancer patient and survivor. So we look into the three aspects that involve in the acute, long-term, and also the late effect of these cancers. So exercise can reduce the symptoms, okay, the symptoms and the side effect during cancer treatment and after cancer treatment, okay. So this is very good for patients, cancer patients and also the survivors, both, okay. So yeah, and another things that we always think or thought about is which exercise that work best for you. So okay, we go to the next slide. So this is the research done in 2018 regarding these three cancer-related symptoms aspect, the physical, psychophysical, and also psychological aspect. So they conclude the exercise that is work the best that for these symptoms. Okay, so they divide into aerobic, resistant, and strength exercise. Aerobic is the cardio exercise. Resistant and strength is the to improve your muscle strength, your muscle power. That weight and impact exercise, the weight bearing. Okay, that means you put stand, like standing, walking, or that, even jumping. So they also have balance exercise, flexibility, and also relaxation exercise. So they are giving, they see which is the best that work to reduce the cancer related symptom. So if you see the tick there is actually the aspect that is improved by doing the exercise that listed above. Okay, so for example, aerobic exercise is good to help you reduce, improve in terms of the muscle and fat mass imbalance. Other things is like the catches here is also something similar to reduce in your muscle mass. Okay, and then it's also help to reduce pain, fatigue, and sleep disorder, and as well quality of life, to improve the depression, anxiety, and also quality of life. But you don't have to worry about these very specific things, which they already conclude that among all these exercise, actually there are certain things that the most important and is very beneficial for everyone. Okay, so it's in general. Okay, we go to the next slide and I can show you that. All right, so I think before that got one more. Let me check. Oh yeah, correct. After that, I tell you about the type of exercise. Okay, so we look into the type of the needs and also type of exercise that we need to do. So looking at that just now, so if you say that you want to improve your flexibility, so you say you feel your body tight, then you want to be more flexible. So type of exercise that you can do is stretching. Okay, so you don't have to look too specific into that aspect just now, but it depends on what you need. So flexibility, you can do stretching exercise. So it improves your, reduce your muscle tightness, okay? So if you want to go to improve your fitness, you want to improve your cardio, you want to improve your endurance, then you go to aerobic or cardio exercise, okay? And other things for your strength, let's say you feel your body weak, your muscle is, you feel easily tired or you get fatigued, you improve your body strength by doing strengthening exercise or resistance exercise. So strengthening exercise, as long as you contract your muscle, you work your muscle, and you put on some weight, that is considered as strengthening and also resistance exercise. Okay, and if let's say you have the needs that that require you, let's say you are imbalanced. When you walk, you feel, oh, I feel like I'm easily want to fall. You feel like you're not balanced. So balance training is definitely the best for you. Okay, so that's how you plan your need and set your goal. And other things, set goals, you can use this SMART formula. It goes with specific, measurable, achievable, and realistic, and also time. Okay, so I give you the example down there. So this is, they said, I will go step exercise for 5 minutes every day for 2 weeks. So you set your exercise, that means you do step exercise for 5 minutes. That means you're very specific, measurable with the time. And you want to do it every day. And the time is 2 weeks, for 2 weeks. So impossible if you do it, step exercise for 1 hour every day for 6 months. So it's something that is non-achievable, not realistic, and definitely is also, at the end of the day, you don't do your exercise properly, okay? All right, so this is the important part that you need to understand about it, okay? All right, next, we go to the next one. Yeah, so I conclude this to make it easier for everyone to design or as a guideline, general guideline for everyone. So I just now got 4 types of exercise, and here I add another one that is very, very important. You need to do breathing exercise. We will also show this during our demo later. So breathing exercise is a must. You need to do it before you do other exercise, and also after you do the exercise, you can do breathing. And advisable, you do minimum 3 times per day, okay? Daily, you can do every day, no harm. And second thing, you need to do stretching. Why you need stretching? Because we want to get our flexibility, okay? So this one is specific to your own needs. It doesn't mean that you have to do all types of stretching in a day. It will take you the long hours. So you just choose which one that is suitable for you. You want to stretch your back, or you want to stretch your leg, or maybe your arms. It depends, okay? You can do it alternate, like one day you do one type of stretching, okay? You can also do daily. You can perform it 3 times a day, also no harm, okay? So this aerobic exercise. Aerobic, for you, I suggest we can do low to moderate intensity. So we want to do exercise that is safe, and consider that because we narrow this session for patients, cancer patient and cancer survivor patients. So advisable that you need to do low to moderate intensity, which can be done 2 to 3 times per week, okay? And the research in 2019, they do advise that, or they found that if you do the exercise 2 to 3 times per week for 6 to 12 weeks, it will help you improve your or reduce your cancer-related symptom, okay? Same goes to this resistant and strengthening exercise, also low to moderate resistance. So it is the same formula there. And another extra for you is you need to do balance exercise. It is very important for any person that needs or required this balance exercise. Like I said, you might feel that your body imbalance, you easily fall or going to fall, then you can do this balance exercise. It's just that when you do balance exercise, you need someone to accompany you, because sometimes someone to help you or to support you when needed, okay? So this can be done like daily, and you can do it once a day, okay? All right, so I think this part, this is the part of the exercise for as general. And after this, we will, like the next section of our presentation, Esther will continue it, okay? All right, Esther, I pass it to you.
Okay, thank you, Liyen. So I'm continuing on with a bit of discussion regarding exercise, immunity, and the current COVID-19 crisis. So we realize that a lot of our people, and not only SCAN members, are very concerned about our health during this crisis and how we can survive this crisis safely and successfully. Now, there has been some questions going on whether we should exercise or not, and I received that because some people are thinking we should conserve our energy because we need to fight a possible infection. So here I'm going to discuss a little bit on exercise, immunity, and the current crisis. Okay. Exercise has been shown to be actually beneficial for immunity. If you go through the medical review of articles, most of the specialists will actually reach a consensus where they say exercise in general is beneficial. Okay, so this is from Medline Plus. Physical activity or exercise may actually help to flush out bacteria and viruses from the lungs and airways. So this is of special concern, especially for those of us who who happen to go out. You might happen to be exposed and you want to get the dirty things and the virus out of your system as fast as possible. So if you exercise, let's say once or twice a day, and you get the system moving, it's a good way to flush out the bacteria and the virus. But, okay, there's a but here. You have to realize that when you're exercising and you are flushing out or shedding the virus, you do not want to be near to other people within your family, okay? There is a reason why the virus outbreak in Singapore affects a lot of gym goers, because these people are exercising together in proximity. And if you happen to be a carrier and you are actively flushing out some virus or bacteria, the potential for infecting other people will be higher. So please do take note that while we do encourage exercise at home, please still maintain social distancing and personal hygiene, okay? Second point, exercise causes changes in antibodies and white blood cells. So these are the main or the important immune system that fights diseases. So exercise is one of the ways that boosts up our immune system. Third point, when you exercise, there's a brief and slight increase in your body temperature. So some research actually come out and say that this actually helps the body to fight infection better because it is similar to a body's response when you have a fever. Okay, so bearing this in mind, you will also have to apply some common sense to this statement. Let's say if you are already sick, you are having a mild flu, you might be having some fever. You will not want to use exercise saying that exercise is going to increase my temperature some more and fight the disease. It will not work that way. So please employ some common sense. Okay, lastly, this is a very well-known fact that exercise lowers your stress level, okay? So when you are happier and less stressed, your body can fight any infection better. Okay, so now I want to show and share with you one specific journal article that is actually going to be published next month. It's officially not published yet, but the results have already been emailed and circulated to a lot of online newspapers in the US, and it has reached here because I have at least 2 physical fitness coaches who forwarded this article to me. So I'm showing this article because it directly addresses exercise and the effects of exercises on the immune system. So in the picture is Dr. Chen Yan, who has been studying the effects of exercises for a very long time, but mainly in the domain of cardiac or cardiovascular health. So lately they have been showing and highlighting this special compound or antioxidant called extracellular superoxide dismutase, ECSOD, a bit of a mouthful, but you can see the short form there. Okay, what they discovered is that this antioxidant is released by muscles, even at rest, okay? But the production of these antioxidants is actually increased during exercise. Okay. So the scientists are actually finding a way to use this knowledge to benefit the general population in 2 ways, okay? One is preventive, meaning they are encouraging people to exercise more so that you have a good and healthy muscle mass. And that means your body can produce more superoxide dismutase to fight against any diseases and specifically against coronavirus in this current crisis. And secondly, they're actually looking into using this superoxide dismutase as a therapeutic measure. Okay, but that is a long research then not applicable to us yet. Okay, so this is a bit sharing for you, just to let you know that when we exercise, we are not looking at exercise in terms of developing muscle strength and the ability to move we are actually looking at the benefits of exercise and muscles in terms of how it impacts the immune system. Okay, so Liyen has already gone through the SMART and how to plan goals and all that. So we're going to cover a little bit more, a broader but basic guidelines on how to do exercise safely, because we already know it is safe to exercise and it is good to exercise, but as a special population, we have extra concerns. So how are we going to do this safely? Okay, basic guidelines. Firstly, you need to know your needs. What are you doing this for? And then you need to set your goals. So Liyen already gave some very, very nice examples, okay? So secondly, before you start, you need to check and know your own health status, okay? So there are many methods and ways of knowing how healthy and fit you are for a particular form of exercise. But the two simplest way to actually go about it is, firstly, you have the heart rate monitoring. And secondly, you have the box scale, okay? So I will go into it a little bit later after this, okay? So basically, we want you to be able to monitor your body and to be aware of how the body is performing during your exercise, okay? Third point, as with any exercise program, before you start, there must be a warming up, okay? And after you are done, there must be a cooling down, okay? These are basic guidelines that most people will know. Okay, fourth point, the weather is very hot nowadays. Stay hydrated. Drink more water. You know, as some minister already said, you drink more water, it flush out the bacteria. Fifth point, proper shoes and clothes, nothing too restrictive. So we want it to be stretchable and you can move around freely. Six, with exercise, we always go by the principles of starting at the lower level and you progress slowly, let your body adapt, okay? And lastly, stretching. We need to emphasize this a little bit because lately a lot of people have been very interested in a lot of stretching programs like yoga and Pilates. And with this kind of interest, we want to make sure that everybody go into it safely. So the main point here is do not stretch. Do not overstretch, not do not stretch. Do not overstretch. You have to know your own body's limits, okay? Okay, so how to monitor your exercise intensity to make sure that it is safe. Okay, in the medical line, if you are in a clinic, let's say, or if you are working with a personal trainer, one of the ways we do it, the best way actually, will be to actually monitor your heart rate. And this is usually done by using a heart rate wrist monitor. Okay, so you wear it on, it gives you a real-time reading of how much is your heart rate, or some is actually advanced enough to show you your blood pressure. So it tracks that. But not everybody have that, okay? So even if you have that, you have to know what is the range that I should be working in, okay? So a little bit on how to calculate, okay? The maximum heart rate that you should stay away from, that is the maximum, we shouldn't go there, okay? It should be 220 minus your age. So it is age dependent. So let's say I have somebody who's 60 years old. So the maximum heart rate, okay, which they should not go over, would be 220 minus 60, and that would be 160, okay? So what are we aiming for? So we want to aim for a low to moderate intensity workout, like what Liyen mentioned, okay? Low to moderate intensity. So according to the Mayo Clinic, and you can look for other sources as well, the general consensus is that you try to keep your heart rate at a level of between 50 to 70% of your maximum heart rate. So let's say I'm working with a new person, so we are going to start to be a bit more safe. I will calculate it at 50%. So 50% from the maximum heart rate will be 160 divided by 50%. So we will be working at a heart rate of starting from 80 beats per minute to a maximum of 120 beats per minute for a person who is 60 years of age, okay? So that is using heart rate to monitor your workout intensity. You keep within a safe range, low to moderate intensity. Okay, a lot of people don't have the wrist monitor for heart rate. Okay, so what do? Okay, this is a very simple way that actually a lot of therapists and clinicians use to monitor our patients when they are doing the exercise program. So it is actually quite easy. You have a scale. It's called the ball scale. We measure your exertion from a scale of 0 to 10. Okay, 0 will be zero activity. Okay, where you feel like you are not doing anything, like you're just lying down and sleeping. So between 1 to 2, it's comfortable activity and you can extend for a longer period of time. How we gauge that is looking at the way you breathe and whether you are able to talk or not. So that is the best indicator, how you are breathing and how well and comfortable you can talk. Okay, so since our aim is low to moderate, we'll be working at a level of say 1 and 2, not much, but more of 3 to 6. So box scale at a level of 3 to 6, which corresponds on the other side of a heart rate between 50 to 75% maximum. Okay, so what should you be feeling, okay, when you are working at this level? So I've narrowed it down for you. So using the box scale, what you should aim for, what you should be feeling if you are working at a level of 3 to 6. Okay, on the left hand side, the plus sign, you see. So during exercise, you should be able to feel an increased effort to breathe. Okay, mean if you think you are exercising but you are still breathing like normal, probably you haven't started yet. So you can be a bit more adventurous and push yourself a little bit more. So that being said, you should have slightly increased effort of breathing, and you should be able to talk in a full sentence. So talking shouldn't be much of a problem, okay? So move to the negative part, which is in red. While you should not feel when you are doing exercise, you should not feel out of breath, okay? This is different from having increased effort of breathing or heavy breathing. Out of breath means you're actually having to work harder to catch your breath, okay? It's uncomfortable, okay? And you should not feel that you have to make a big and huge effort to move and to speak, okay? If you feel like you have to push yourself and make a big effort, you are probably working beyond the moderate intensity already, okay? And the last pointer, if you are unable to speak comfortably in the full sentence, you need to slow down, okay? You are overworking already. Okay, so different types of exercises. Liyen, would you like to explain a bit more for the ones on the left?
Oh, okay. That one is just a question. So
Okay.
all this aerobic, Zumba, Pilates, yoga, Tabata, that we want to know whether they are safe or not. So this is the things to consider is also similar to what you have there. Yeah.
Okay. So yeah, because a lot of people, there are a lot of exercise programs out there. So Liyen has prepared a list that is more happening nowadays. There are new forms of exercises coming out like Tabata and even Pilates and the high intensity interval workout or the HIIT workout. I'm sure many are already quite familiar with aerobics and Zumba and yoga and Tai Chi, which has been around for decades. So let's say you are keen or interested to pursue one of these. So you're at home now. So you found some interesting YouTube videos that are showing the exercise and you would like to follow, right? So we get this question, is it safe to follow these online exercises? Is it yes or no? Is it safe or not? So before I answer that question for you, I have to say that this is actually very individualized. Okay, you have to ask yourself first thing to consider, what is your current fitness level or your baseline fitness level? It is very different for everybody. Even if you have the same illness and you have gone through the same treatment. So everybody comes out a little bit different, okay? So you have to consider whether your current fitness level is low, moderate, or high, or totally gone already, okay? We don't know. So this is something you have to consider for yourself. Now, second thing to note is your previous experience of exercises. Now, this is the very important thing that we actually always try to dig out from clients, because those people with previous experience of exercises in one of the examples given on the left, usually you will have some muscle memory of the movements, okay? You, even if you had not done it for the past 20, 30 years, let's say, but your muscles will still retain some of the memory, okay? So it let me know that you probably know the moves already. And if you say, I used to do aerobics 30 years ago, can I do online aerobics class now? My answer will probably be yes, okay? And the last thing we look at is your recent history of exercise. So we're looking at the last 3 months, you know, in a really recent as in the last 3 months, right before the MCO was enforced. So in the last 3 months to a maximum of 6 months, if you have not been doing anything at all, we'll have to consider that maybe your fitness level is already very low. But maybe 3 months ago, right before the MCO, you were very active, okay? So it's a different story altogether, a different consideration. So if you have been very active and you do have previous experience of the exercises that you want to pursue online or with the YouTube videos, by all means, go ahead, okay? So we go back to the reminder, okay, that Liyen was presenting just now, okay? Go back to the basic guidelines, okay, and refer back, okay? And you must continuously monitor your intensity level and keep to the recommended intensity range, okay? Okay, following YouTube exercise videos. So what are the other issues you need to consider? Okay, YouTube videos are pre-recorded videos. It's different from online classes where it's usually live, and there could be some minimal or moderate interaction between the coach and the participant or the student, okay? So when we are talking about YouTube videos, it's pre-recorded videos, okay? So the first thing you need to consider is the potential risk or danger from those videos itself. And we are talking about when you see a video from don't know where, but it looks very interesting and it's very well presented. The concern is that sometimes the techniques might not be correct or the instructor might not be properly trained, because we don't know whether they are accredited, you know, whether they are trained properly and whether they have the credibility to conduct the exercises in the first place. And this is very true for certain exercise programs like yoga, because yoga is not properly, there is no proper certification and all that. But if you are talking about a established program like Zumba, the Strong Nation Zumba, and you're talking about Pilates, now we know for a fact that these instructors are probably licensed, and you can actually check back to see their license number, whether they are actually certified to teach or not. Okay, so you need to check back on the credentials of the videos to see whether they come from a reputable and reliable source. Okay, so secondly, the problem with YouTube videos is that there is lack of monitoring and correction for you, the participants. Okay, so even if a coach in the video is showing you a correct movement, right? So you are seeing a correct movement and you are doing it, you might not be doing exactly what you see. So even if you are doing a wrong movement or a wrong technique, you might not know it. And the danger is there. So there are some people who are unable to identify and correct themselves when they are actually doing exercises. So that is where our concern is, okay? And secondly, when you are picking up videos by yourself, suka-suka, pilih, you know, it might not be at a suitable level for you, or it might not be the suitable type of workout for your particular need, okay? So the overall concern here is that there is a potential risk for exercise-related injury, okay? So that is an answer to that question. Okay, any questions so far? So
yeah, maybe are we going to have any demo before that?
I think we can take some questions first before we start the demo.
Any questions? I think there's a question already.
this question.
Yeah, I cannot see the question, Anne. Can you read it out for me?
Okay, there's a question for a person with, this is from Bunlu, yeah? For a person with moderate fitness level, what is the recommended duration of exercise in a day, and how many times a week is ideal?
Okay, the answer to that depends on the type of exercises you are going for, okay? So let's say we are talking about aerobics exercises, okay? The general recommendation for aerobic exercises, moderate intensity, is 30 minutes, okay? 30 minutes, 5 times a week. 3 to 5 times, okay? We don't make it absolute 5 times a week. 3 to 5 times a week at the moderate intensity.
Okay, does that answer your question, Bunlu?
So that's one example, like for cardio, like for resistance training, it won't be 3 to 5 times a week. It'll be 2 to 3 times a week. Okay, so you can always refer back to the basic guidelines. If your goal is for strengthening, you follow the recommendations for the strengthening program. If your goal is for cardiovascular fitness, you follow the recommended regime for the cardiovascular fitness. So next question.
Yes, another question, I think, please give example of each type of exercises so we know what you are referring to. Example, resistance exercise.
Okay.
I think they're asking, but if you're doing
maybe I can for with the demo, or I can maybe I can just answer it first.
Yeah, okay.
This one we refer back to the, you see the needs and also the type of exercise just now. So if flexibility exercise is the stretching exercise. That means if you stretch your hand, okay, you away from, let's say you want to stretch your bicep, so you open your hand like this, your muscle is lengthened, that is the stretching exercise. For example, you want to stretch your tricep, you pull like that, this is the stretching for your tricep. This means you make the muscle lengthen, okay? So that is stretching exercise. And aerobic exercise, cardio, is any exercise that you do that require longer duration with a low intensity to moderate intensity, but it needs like longer duration, which is about 20 minutes, more than 20 minutes to 40 minutes, depends on your own level of fitness. Yeah, so free exercise, you do cycling, even you do walking, running, that is also considered fitness exercise. Okay, so strength exercise, let's say you take a dumbbell, right? So you hold something heavy. For example, you hold, yeah, this are the things that I can grab. So you hold something as dumbbell and you lift it up, okay? So you're giving some weight to your muscle. That is already strengthening, okay? So if, let's say, you do something like sit to stand, okay? Or you do squatting, okay? You do squatting, you squat, you do to strengthen your muscle, your quadricep, that is already strengthening exercise, okay? But strengthening, it will always go with repetition. That means, oh, you do 3 sets of 10, 4 sets of 10, that is strengthening. And balance training is, for example, is you do single leg stand and you try to balance yourself, or if you stand on a soft surface, for example, like cushion, stand with one leg. So that is the balance exercise. Okay. All right. So does it answer your question?
Yeah,
All right.
I think should be all right. Yeah.
Yeah. Thank
So
you.
there's another question. What type of exercises is suitable for cancer patients that are in treatment and a bit weak?
Okay.
Okay.
Yeah. Esther,
That one
can
is
you
from,
you have?
yeah, so I'm bringing you back to the box scale. So can you all see the box scale? Okay, so now this is the in response to a very specific question, which is a very good question actually. So what if you are in treatment, or maybe, okay, another scenario, you just came out of surgery, okay, and you would like to start exercises. So the question is, how do you do it safely and within the range? Is that right, Chris? Okay, so if you look at the bulk scale, we always say low to moderate intensity. But if you are coming out of a treatment, sometimes even before you start, you already feel that you are at a bulk scale 3, 4, 5, or 6. Okay, so those who have gone through the process or have cared for somebody who have gone through chemo or even radiotherapy will know that during the active phase of treatment, while we do encourage exercise, a lot of the patients are already tired to start off with, and they're already in a bulk scale range of somewhere between 1 to 4. So we are talking about somebody who will think that it is a lot of effort just to even sit up in bed. It is a lot of effort to even get out of bed and walk to the toilet. By the time they get to the toilet, they might have slight breathlessness already, and they're already a bulk rating number 6 with just that simple movement of going to the toilet and back. Okay, so in the light of this situation, we can always, there's 2 ways to look at it. One way, we can always tell you, functional activities is also a form of exercises. Okay, so what we can do is that we will ask you to actually actively increase your movements at home. Okay, so movements are also exercises. So if you are at that stage where walking is already tiring, that walking in your home is already the exercise. You do not need to follow any fancy programs. Okay, so walking to the toilet or walking even 1 flight of stairs up your home to get to your bedroom, we consider all of that exercise. Okay, what we might add on is exercises that you can do at the level of 3 to 6, but you will still be able to tolerate it. Example of this would be, firstly, we will always start with the deep breathing exercises. And why is that? Okay, imagine if you are sitting up in bed and that is already tiring you. And we are going to start with deep breathing exercise. So when you take in more oxygen, it will actually be more energetic for you. The breathing exercises by itself is not tiring, but if you do it often enough, you will get more oxygen in your body, and the end result is that you're going to feel stronger. Okay, and a lot of the exercises can be done in lying and in sitting. As you can see, if you can see behind me, sorry, you cannot see it now. We have a chair behind us, Liyen and me, because we're always prepared to have patients exercise in sitting. You don't have to be standing. You can do it in sitting. So you can do stretching exercise, strengthening. At the stage that you describe, when you're in active treatment, you will not be able to handle weights. You don't need to handle weights. You don't need to carry anything heavy. All you need to do is to work with the weight of your body. Your arm is a weight. Your leg is heavy, it is weight. Okay, so basic moving your hands up and down, swinging your legs in bed, pumping your feet, moving your ankles up and down, that is your exercise already. Okay, and breathing, actively moving in bed or in a chair, so that will be the type of exercises you'll be aiming for. Okay, so in what I'm trying to say is that we still exercise, but different forms of exercise, and you can still keep within the low to moderate intensity level. So always stay within that level.
Okay. Yeah, I think we'll go to the next question. There are a few more questions coming up. This is from Dayang Mariani. The question is, I fell in November 2018 because of being a cancer survivor and osteoporosis. My bones has not really filled in. I have 7-inch plates, 7 pins. Now with no physiotherapy because of MCO, what are exercises I can do besides the ones I had in the hospital?
Okay, I think I will answer this. For Dayang, your case, we need more detail on what is happened to that the plate and all this. So can we have that a separate session like telehealth for Dayang to get more details for her? Is that okay, Dayang? Because I'm a bit concerned if we go with too general for you, it's better to go more on one-to-one session. Yeah.
So probably we'll take this offline later with Diane.
Yeah, we will arrange a telehealth for her,
Yeah, okay.
for Dayang, if Dayang okay with that. Yeah.
Yeah, actually, to follow up with this session today, actually, those who have more personalized or issues like Diane, we actually offer Liyen will be doing telehealth services or over the phone consultation, which we can arrange later via scan. Okay. To elaborate a little bit on what Diane actually brought up. You know, when you look at the exercise that Liyen explained just now, the 5 types of exercise, you'll find that the last one, what did we mention? Balance training. Okay, a lot of cancer survivors, because of the medications you took, or maybe if you have a cancer of the ovaries and has been taken out, a lot of factors involved. A lot of cancer survivors come up with osteopenia or osteoporosis. Okay, that problem coupled with neuropathy or loss of sensation will also lead to loss of balance. You might not feel it, so unless we test you, okay, you might feel you're okay, but you know, you never know until you're really tested. So falls is actually one of the big issues affecting cancer patients. That is why it is included as part of the important exercise that we encourage people to do every day. Okay, if you look at other non-medical or non-therapeutic exercise programs, yeah, everybody talk about cardio, everybody talk about flexibility and stretching, but balance is the one thing that is might be missing, and that is one thing that we really would like to look into, okay, before the problem starts. Okay, Anne?
Yeah, I think this next one is not a question, it's a statement I think she's trying to share with us from Grace Sim. I have been doing yoga for the past 20 years. Just want to share that somehow yoga is an exercise whereby you need an experienced teacher to show you the proper ways. We can easily hurt ourselves if don't do yoga properly. I had a friend who could not do yoga forever because she hurt herself and unfortunately is undergoing acupuncture currently. So probably this is something she wants to share with us. So I'll just go on to the next question. May I know, this is from Swee Kyung, may I know if cleaning house such as sweeping the floor is considered as a form of exercise?
Is there an answer or me? I can answer also for
Yeah,
that.
yeah.
You know, the sweeping, doing housework is considered as our activity daily living. So it's not included in your exercise unless you want to, you say you want to do this sweeping for the purpose of exercise and you keep sweep the same position and repetition. So yeah, just separate it. This activity, the living, you need to separate it from exercise. Even though you do lifting a lot, with you lift up a weight during walking also, it's not considered as exercise. So you still need to do exercise in a separate session. Yeah. And if let's say you get tired of doing sweeping and you know you do all this work, it does gain some of your strength, or that if you do a lot of weightlifting. But when you talk about exercise, not necessary after sweep floor or cleaning you must do weight exercise or resistance exercise, but you can go with stretching maybe just to ease or relax your body after that. Yeah. Okay. And
Okay.
to add, Esther?
Well, not really. So, you know, it's the intention behind the activity itself. Like if you had to sweep the floor and your husband say, hey, you haven't exercised today. And then you say, yeah, I sweep the floor already. That is exercise. So probably, you know, it is not. Your husband is probably correct, you know. So it's the intention behind the activity. If you are very, very deconditioned and all you can do is hold the broom and you just sweep by your attention, I'm moving, I'm exercising my hands, then that is a form of exercises. So the goal behind the activity.
Yeah.
That's the next question from Tony. For people with lymphedema arms, what are the type of exercise to do and to avoid?
Okay.
Liyen will be doing a demo on this actually. So we will answer
After
this a bit later.
yeah.
All right. So any more questions from the other participants? If there's no questions, probably we'll go on to your demo, Esther.
Okay, the exercise demo. So you probably can look at the slides for a while first, or you can look at me. Okay, can you, yeah, no, am I clear? Okay, deep breathing exercise. Okay, it's one of the first things that we start off with, because first thing, deep breathing is beneficial for stress management. You know, so if you have less stress, then you can fight any diseases better. And secondly, deep breathing exercises is always the start of any exercise class. Okay, so how do we do deep breathing? There are many techniques out there. Okay, there are fairly simple ones to more complicated ones. So we pick simple. Okay, we'll go simple. So how do you do deep breathing exercise? Before you start, first, I want you to be aware of your breathing at rest now. So how are you sitting? So I'm watching you. So how are you sitting? Are your shoulders relaxed? How is your head position? Which part of your lungs and chest are you currently using to breathe? So take a bit of time. How are you breathing? Okay, so some people might be breathing more from here, some from the lower part, okay? But for deep breathing, most people would know. We'll be aiming for the abdominal part. So I'm gonna let you see, we're gonna do deep abdominal breathing, okay? So you'll be putting both of your hands on your belly, okay, on the lower belly. Is everybody following? I cannot see it. Liyen, please help me to check who is not following. Please try to follow. This is not a demo where you watch only. So everybody, please try to follow along. Okay, hands on your belly. Okay, so we are going to do a deep, slow inhale through your nose. Exhale through the mouth. Okay, so exhalation should be slow. Can you feel that? So Liyen is going to be checking you all. Breathe in through the nose and
Yes.
out through.
No face, come up.
Please don't forget your videos. Okay, I'm going to stop share so I can see the whole lot of you. Okay, so we're going to do a bit of test now, okay? So to see how good is your lungs, you know, how strong is your respiratory muscles, okay? So first test, I want to see how long you can stretch out your inhalation, like breathing in. So I'm going to breathe in, and I'm going to count. I can breathe in slow and it takes me 10 seconds. Can you try and see if you can inhale slow and deep, and how long can you inhale? Okay, so everybody try. Very good, Mahesh. How many seconds was that? That was quite good. Okay, so Mahesh, how many seconds did you manage? Yes, Michelle. Okay. This why is there an extra? So I cannot really hear you, but you take note. How long did you take? For somebody who is very deconditioned, it might actually take them only 3 to 5 seconds. Cannot already. They cannot do a slow deep inhale. So how many seconds you can manage to slowly pull in the inhale will tell you where you are, you know, how good is your lungs, okay? So second test, okay? You take a note yourself, you know, how well you perform. Okay, we're going to do a breath hold. A breath hold is where you breathe in to the maximum, you hold your breath, and you count, okay? If you have a time, you know, a timer is even better because some people count very fast, some people count very slow, okay? So if you have a stopwatch or timer, it'll be even better, okay? So shall we have a go at it? You're going to breathe in, hold, and then you try to count. How long can you hold your breath? Yeah, all doing pretty well. I can see, can hold for very long. Okay, so the challenge is that you take note of how well you perform today, and then you try to do deep breathing exercises 3 times a day as recommended. And at the end of 2 weeks, you test yourself again and you see where it takes you. Okay, so now we're going to do the deep breathing exercise. The first one, very easy. All you have to do is put your hands to your belly. When you breathe in, you inhale through the nose. You should see your belly puff up. Okay, it's not, that one is wrong. Huh? Breathe in. Let it expand your belly, and when you exhale, come back in, okay? Breathe into the nose. Inhale in, nice and slow. And when you exhale, it should be a passive movement, okay? Exhalation is not, it's not pushing out the air. It's a very relaxed form. When you relax, the air is going to come out naturally by itself, okay? Shall we try that again? Inhale in. Pretend you are smelling something very nice. It's a very relaxing move. Inhale in slowly and deep. And you exhale, okay? So this is the simplest form of deep breathing, okay? We have done 5 times just now, so we need to stop, okay? For deep breathing, we have to cut off at 5 repetitions, and you need to rest for a while before you continue, because if you keep doing, you'll be hyperventilating. Hyperventilating will cause too much oxygen in the brain, you might get giddy, okay? So 5 repetitions, and then you stop, okay? If you want to repeat, you can repeat after another 2 to 3 minutes, okay? So you can do 3 cycles, and you do this 3 times a day. Is that okay? Okay, shall we move on to the next? So I'm showing you the slides now. So this is called the ACBT. Okay, and I'm going to guide you through because it's something that has gone actually a little bit viral, starting with some doctors in the UK and some nurses. You'll find that they have been making recommendations on breathing exercises to help COVID-19 patients recover faster. Okay, so the breathing technique they use is actually called ACBT. Sorry, there's a bit of a typo there. We will correct the slides before we send it on to you. Okay, so ACBT, or active cycles of breathing technique. Okay, active cycles of breathing technique. So it is a technique which was primarily used by physios to assist patients with a COPD to clear their lungs. Okay, so this technique is already being used widely to help COVID-19 patients to increase their lung functions and clear out the mucus. But we don't have to wait until we develop some lung diseases before we learn techniques like this. Okay, so I would like you all to have a run through this exercise because it's very effective for, firstly, expanding the lungs, okay, and then secondly, it will help you to clear out any mucus that can be inside, especially in the deeper parts of the lungs called the alveoli, okay. So it's very easy. It's a continuation of the deep breathing, but with 2 addition. Okay, so the first addition is that after you inhale, you need to hold for 5 seconds. Okay, it doesn't have to be exactly 5 seconds. If you can only manage 3 seconds, so be it. Okay, so don't force yourself. Okay, so first we're going to inhale deeply, slowly to a count of 5. Then we're going to hold your breath for 5 seconds. And then you're going to exhale. So the exhalation is relaxed. No need to count, okay? We're going to repeat again. Second set, inhale. Hold for 5 seconds. And exhale. Third round, inhale. Hold 5 seconds. And you exhale. Fourth round, inhale. You hold the breath for 5 seconds, because when you hold your breath, all the end airways and alveoli is going to open up. And exhale. Okay, this is a special part. The fifth round, what do? You inhale. Slow deep inhale as much as you can. At the end, you cough. So that helps to expel out the lungs from the deeper part of the lungs. Okay, so everybody got it? Remember, there's 5 rounds. Okay, 4 rounds of deep breathing and hold the end breath. Okay, at the 5th one, you cough instead of holding. Okay, very simple, right? Okay, so that's the end of the breathing exercises. And now I'm going to stop sharing the slides so you can all please take a look at Liyen.
Yeah. Esther, you can help me also. When I do it, you can tell which part I stretch. Huh? Okay, so
I'll do the audio part. So I'll be taking a look at Liyen and all the rest of it. So please try to follow the demo if you can, okay? So the good thing about the demo is that if you happen to do something wrong, we can pick out and we can feedback to you, okay? So be a bit more adventurous lah, gerak-gerak sikit.
So the first one, this is a lymphedema specific exercise. So it's kind of revision. If you attend our talk, SCAN talk previous year, if I'm not mistaken, we also show this exercise for lymphedema specific. Yeah. So the first we call elbow winging. So you can do in sitting, you can do in standing. So you put your hand at the back of your neck like this, from here, okay. So what you do is you open your hand as wide as possible, stretch your chest, and relax it, okay? You can do as a movement exercise, and also you can do as stretching. So if you do movement, you don't have to hold it. You put there, and you keep moving, open up, and relax. Back to the starting position. You open it up, and back to the starting position. So it helps to move your shoulder joint, prevent any stiffness, any so the movement is getting loose over there. And if you do stretching, you open your hand and you hold there for 15 to 30 seconds. Okay, 15 to 30 seconds. That is stretching already. It's the same exercise, but you can do few things. Okay, you can do few things. So it's very good because when you have lymphedema, you need to exercise your shoulder. This is your big joint. You need to clear everything from the top first, then only you can clear everything that from the distal part, the smaller part. Okay, so that is elbow winging. So you can do a lot of repetition, 10 for 1 set, and you can do up to 30 set also can. Okay, that's the start. Okay, that's number 1. Shoulder blade squeeze is you are squeezing your shoulder blade at the back here, which you put your hand backward and like this, and you are squeezing your shoulder blade. You're not moving your elbow to the back like this, but what you do is you are squeezing the shoulder blade. From here, you squeeze your shoulder blade. Okay, put your hand, squeeze, and relax. Squeeze and relax. Okay. So same thing. You can do as a movement, or you can also do as stretching. If you hold it, you can do stretching. If you keep moving, you are doing mobility or movement exercise. Okay. So side bend is you are stretching the side of your arms and also your trunk. Okay. Can do in sitting or standing. Put your hand up and you stretch to the side. Very good. Can you feel the pulling there? Okay. And come back. And you stretch to the side, the other side. Hold it there. And come back. Okay. So this one is for your shoulder and as well as your trunk. Okay, the side of your body here. You want to stretch it, or you can just modify, do it this way also can. Yep. Everyone good with that? Okay, that's simple, right? So we go to the fourth one, which we call when exercise. When exercise, you need stick if you have. I have a very long one here. If not, you can just do without. Okay, you can do without. So just hold the stick. Stick is good to guide you. And this is my broomstick. You can use yours as well. So sit straight, keep your body straight, lift up your hand to the maximum. So from here, you stretch up as much as you can and put it down. Okay? So if you put something, like maybe you have some weight, put it inside or send back. Okay, you tie bottle over there, that is already become your weight. So you can do resistance exercise. Okay, so you give you weight, you do the same thing. This one you don't have to hold long, bring up and bring it down. Bring up and bring it down. So this is example of your resistance exercise. Okay, quite clear? So go back to here. If you do without the weight, it will become your stretching, either your stretching or your mobility exercise. All right, good. And chest wall stretch, you need the wall to do it. I will show you, but maybe you can do it later by your own. But you can see me or not. Wait, all right, so chest wall, is that clear?
Yeah, we can see you.
All right, so you put your hand like this forearm at the wall, okay? So one leg in front here, and then your hand at your waist, the other hand. So from here, you stretch it. So what you do is actually you open this up, okay? So from here, and you open this up. This will have two angles, which you can start with 90 degrees first. If you have the corner at your house, will be easier. Okay, so put both arms at the corner, at the wall, like that. Okay, so put at the corner, and then you can stretch it forward. Okay, so this is what happens. So you put your hand there, and your body is moving forward. You are stretching this part. You should feel somewhere at your chest area to help, because most of us will have this rounded shoulder, sitting a lot. Maybe we do a lot of this computer work at home for now during this MCO. So to prevent that, you need to open up your chest more. You need to stretch your muscle at the chest area. So that is how you do it. 90 degree is one of the angle, and the other one is you go about 120 degree. Okay. All right, so that is the chest wall stretch, right? This is stretching, okay? And if the other one is we call wall climbing. Wall climbing is a movement exercise. It can be also resistant if you hold weight or ball, heavy ball also can. So what you do is you, in standing or sitting, so from here, this is sitting position. So you stretch up. Okay, so you do as much as you can, right? And in standing, you can also do it the same thing. Stretch. Okay. So let's say you have something like maybe a heavy bar, you are holding it, okay? So you want to do that, you stretch up. This also can. So whether you want to do stretching, whether you want to do just movement, you move up and down, or you add some weight, also can. So there is some variety of it, which include of the remember I informed just now, you have this movement, flexibility exercise, resistance exercise, strength exercise, or that. So even you do one type of exercise, then you can do a variety of your needs. All right. So yeah, that is for lymphedema specific exercise, mainly for shoulder, arms, and also your upper back. Okay. Yeah. So the next one, other exercise like stretching, strengthening, a lot of things that we need to show you. Even if you do it complete also, we can't finish it within an hour. So you can always refer to our Facebook page, which they are given you few types of exercise for strengthening and also some resistance or cardio exercise that you can do. You can refer to that. Yeah.
Okay.
I think got a question over there.
Yeah, I think we probably take this last question. Yeah. This from Tony. The chest wall opening up exercise, does this mean that it will harden or strengthen the chest muscles? I understand from a nurse that when the chest muscle is built, it affects the chemo port, making harder to pierce the needle into the chest.
Oh, okay. Chest wall stretch just now is a stretching exercise. It doesn't, it's more on to relax the muscle and to loosen the muscle and make it more flexible. So there's no harm if you do it accordingly. Don't overstretch. Remember the basic guideline just now? So you don't overstretch your muscle, okay? So depends on your own tolerance when you do stretching. If you can go, don't go beyond your pain tolerance, okay? So you know your own body. If you know that's your limit, you don't push it harder, okay?
Okay. Yeah, so I think that we'll end our session here. It's more than an hour already, and we've finished up with this. So if there's any more questions that there is, probably participants can get in touch with SCAN for us to contact Esther and Liyen, yeah? So thank you everyone for participating, and a good night.
Thank you, Esther and Liyen. Well done. Very informative and useful.
Thank you, Esther and Liyen. Thank you for the nice demo.
Thank you so much.
Thank you.
Bye-bye.
Bye.
Bye-bye.
Good night, everybody. Thank you again. And thank you for those that join us on Facebook. This is our first Facebook Live presentation. All right.
I would
Thank you.
offer
Thank you, Anne.
Thank you, thank you.
Thank you, Esther. Thank you, Liyen.
Thank you.
Bye.
Okay, good night.
Bye.